Hello. The goal of this video is to highlight how to use the new student evaluation form. The first question sees if there's any previous relationship or potential bias. The remaining questions each break down student performance into 6 separate stratifications with a not observed category as well. Questions 2 through 7 assesses a student's ability to deliver adequate patient care, including history taking, physical, differential diagnosis, treatment plan, note writing, continued patient care. The choices will be assigned as follows. Critically deficient. If the student fails to generate one or more of a history, physical diagnosis, or plan, they spend little time with the patient or don't know the patient. Significant deficiencies. If the student learns the listed skills but misses major components of the exam and requires frequent instructions, they cannot present a patient in a cohesive manner. Capable. The student grasps 70% of the skills required to provide patient care, or does it well some of the time. They have noticeable improvement with feedback, but requires much instruction to provide care. Consistently meets expectations. The student takes a good history and physical, provides a differential and plan on occasion, but could continue developing these skills with a few missing elements of the exam. Often exceeds expectations. Student grasps the components of providing patient care, including history, physical, differential, plan, and writing the note, and they perform it well on each patient. The student is performing above their peers or at the level of a fourth-year student or an intern. Performs at the top level of an intern. It is reserved for only the top 5% of medical students in each class. They receive little feedback on their history, presents a thorough yet concise history and physical, and does it at the level of an established intern. Question 8 focuses on the student's fund of knowledge. Critically deficient. Does not make an effort to learn about their patient or keep up with the knowledge for their clerkship. Significant deficiencies. Knows very basics but is very deficient in major areas. Capable. Understands the basics, takes feedbacks on areas to read and improves. Consistently performs adequately. Understands the fundamentals and is receptive to learning more. Often exceeds expectations. Good understanding of fundamentals and applies it to patients. Reads material on their own. Performs at the level of an intern. They know this is reserved for the top 5% of medical students in each class. They know well above their peers and are at the level of an established intern. Questions 9 through 12 focuses on students' professionalism, including accountability, initiative, response to feedback, and respects for persons. Again, going through the choices. Critically deficient, the student does not arrive on time, does not complete tasks when asked, and shows disdain for the field. Unprofessional. Significant deficiencies. Does not arrive on time, sporadically completes tasks, does not respond to feedback, not professional. Capable. Arrives mostly on time, accomplishes some tasks, responds to some feedback. Consistently performs adequately. Comes on time every day, works to complete tasks, respects patients and staff, professional. Often exceeds expectations. Comes on time or early every day. Completes all tasks and foresees new ones. Asks for feedback and tries to improve based on feedback, very professional. Performs at the level of an intern. This is reserved for the top 5% of medical students in each class. They are highly dependable and function independently as an established intern. Question 13 focuses on interactions with the medical team and patients and family. Critically deficient. They're not respectful towards the medical team or patients, disrupts the team flow, and does not communicate with patients' information. Significant deficiencies. Respectful to the medical team and patients, but disrupts team flow or does not communicate patient information. Capable. Respectful to the team and patients and communicates information but has trouble integrating into the team. Consistently meets expectations and is always respectful to the medical team, patients, and family. Exceeds expectations. Works well with the team, communicates patient information, and is respectful to everyone, including staff, patients, and families. Performs at the level of intern, reserved only for the top 5%, and they work as if they were already resident. Question 15 focuses on outside factors affecting healthcare. Critically deficient means they have no understanding of the social economic factors that affect patients' overall healthcare or cost and does not desire to learn more. Significant deficiencies, little understanding of the social economic factors that affect patients' overall healthcare or cost. Capable, but inconsistent, some understanding of the social economic factors that affect patients' overall healthcare or cost, working to learn more, asking questions. Consistently meets expectations, understands the impact of these factors that affect patients' overall healthcare costs, asks questions and strives to learn more, often exceeds expectations, understands the impact of the social economic factors that affect patients' overall healthcare cost, asks questions and strives to learn more, reserved for the top 5, performs at the level of an intern. They perform at the top 5% of their medical student class. They come up with novel ways to make an impact outside of the hospital and better their patients. Finally, the general comments section focuses on what goes into the student's dean letter. This will be what residency programs read and will use to evaluate students as a candidate for their program. Your feedback should be a summative yet objective description of the student during their rotation, including strengths and weaknesses and anecdotes you think program directors would like to know. If there are things you want the student to know but don't want to go on their student's dean letter, there is an additional section afterwards where you can fill these comments in. Thank you very much.